Thank you for returning and coming to visit us. We are about to start another session with Dr. Jacob Minang on Optimal Healthcare's Let's Talk About Health. In this series, we've been exploring several of the issues and questions regarding COVID-19, its effect on our population, and the progress and differences in the vaccines. Today, we're going to start with, and we're going to discuss pregnancy and children. So, Dr. Minang, the vaccines we talked about, it has not been recommended for pregnant women because it wasn't tested. That's not a population that is typically used for testing. But how is COVID-19 affecting women who are expecting? Because there are women who are pregnant and have gotten COVID-19. We talked a little bit. You mentioned in the last meeting that women who are pregnant have to have a suppressed immune system in order to maintain the pregnancy. I had never thought of it like that, but you're right. There is a foreign body inside of us and growing, and our bodies need to not reject it. So how does this COVID illness affect a woman when she's pregnant?
Okay, so the short answer is we don't know. It's a very new virus, and nobody has tracked pregnant women for a long enough time. It's going to take us maybe another decade, depending on how long this virus is with us, to answer that. But the long answer is I can answer based on another disease that I know that affects pregnant women. I worked on malaria in the late 90s and early 2000s in Cameroon, in Africa, and a little bit too in Sweden. And we looked at malaria in pregnant women. We tracked the women from the first trimester through to delivery and the first few months of the baby's life. And malaria is a blood disease. It's not a respiratory disease like COVID. It's from a plasmodium parasite, but it's very deadly the first 5 years of a child's life. And there were negatives and positives for having malaria in pregnancy. The first negative is if the woman could not make it, then obviously the child didn't make it. Or if the woman had a serious disease, then the child was born with abnormalities like very low weight, birth weight, and things like that. However, the mothers that made it, the child was born with a benefit. The child was born with anti-malaria antibodies that they had acquired from the mother in utero. And that protected them, yes, during their first few months of life, the first months that are very critical for the babies, and they tended to do very well. The mothers that were not infected during pregnancy, when they had their babies, if the baby got infected during their first few years of life, they were very vulnerable, and most of them died compared to children that were born of mothers that had the infection while they were pregnant. So you passively acquire antibodies. And that's called passive immunity. You don't acquire the immunity because that immunity that they acquired when their mother is carrying them, within a few years of life, they lose all of that and they have to develop their own immunity. But that at least protected them until they develop their own immunity. So I can guess that it might be a similar situation of COVID, but that's only guessing. We don't know because COVID has not been studied like that. So there's a risk that being infected with COVID might make the trigger an immune response in the mother that was supposed to be immunosuppressed, and that immune response might be dangerous for the baby because the mother is not supposed to have a heightened response during pregnancy, and you could lose the baby. But that's just a guess. But it's also possible that if you have that heightened response, but the pregnancy manages to survive, that child is going to passively acquire the antibodies from the mother. So if the child is exposed to COVID during their first few years of life, they'll be protected with the passive antibodies until when they can then start developing their own immune response. So it's a plus and minus. It depends on if you're already a vulnerable woman, it doesn't matter that you're pregnant, your pregnancy is going to be affected negatively by COVID. But if you're already a very healthy person with a healthy pregnancy, you might passively protect your child if you get infected. It'll be the same thing with getting the vaccine. Getting the vaccine during pregnancy, there's a risk that your response to the vaccine might be too much, and you might make you lose your baby. But it's really the response, if you have good immunoregulation and your response is just the right quantity, you passively transfer antibodies to your child that will protect the child. You don't expect the virus to go to cross the placenta and get to the baby. Neither would the vaccine, because the baby placenta barrier, it's very, very, very tight. Very few molecules can go through it. The molecule the size of the virus cannot go through. If it goes through, then that barrier has been broken, and it means that you already had a problem with your pregnancy unrelated to COVID. And we found out these two when we studying malaria. We never found malaria infection in babies, and except in instances where the pregnancy was already complex. We've actually found malaria parasite in the cord blood, in the umbilical cord, in some instances, but not in the baby.
Wow.
Because we look at umbilical cord blood as well.
Okay. Wow.
So that's a long and short answer.
Yeah, it is. But thank you. Wow, that's really interesting though that you could find that in the umbilical cord. So how would the vaccine or even COVID itself as a disease affect a woman's fertility or a man's fertility?
Same thing like the first question, we don't know. It's a new virus that's very new to us. Given what we know about other coronaviruses, we don't expect anything, because the only difference with this virus seems to be the fact that it's more infectious and it tends to really target the lung in a very significant way. But there's no evidence that it affects the gonads, the parts of our body that are responsible for reproduction. Nobody has looked at semen samples to see if they can find the virus there for men that are infected. Nobody has looked at uterine samples, which are typically organs in our body that are protected from the rest of the body. In most infections, you will not find viruses in semen or in the uterus, but nobody has looked at that.
So you don't believe the vaccine would have any effect on that either then?
That's my belief. It's only a belief. Science is not based on belief. It's based on fact and data. There's no data. Yeah.
Well, thank you, Jacob. This, I think, has answered a lot of questions for the younger group for whom this is a real issue. Thank you very much. And I look forward to our next session and perhaps addressing questions about this disease and its effect on children. So I look forward to seeing you then.